Peter Cardwell, good to see you, Peter.
Hi.
And Dr. Saleyha Ahsan from the COVID-19. Well, she is a bereaved person because she lost her father. And as she pointed out to me earlier this afternoon, she also lost many patients. And when I said, Dr. Ahsan, how many patients do you think were lost in the hospital over those first few weeks? You said?
Well, I think total, I don't know the exact number that we lost, but it was a significant number. But definitely during the second wave, 20 plus during those few weeks, post Partygate, December going into January, definitely. The numbers were not small and insignificant, and they were all ages.
And today you were trying to get into the inquiry, but actually it was so hugely oversubscribed to get in through the door that you had to content yourself with waiting outside.
Absolutely. The people sort of speaking on behalf of the bereaved have known that large numbers will want to go. I know there are over 250,000. We're never going to get everyone in, but the venue is small. There were other options, but a larger venue wasn't sought, and I think there were only 18 seats in a viewing room as well, 18 seats. And the system for actually booking, the practical system of actually booking a seat is really complex, and you never know, it's a lottery. You've got people travelling from all around the country to be here.
And explain why. What do people think they're going to hear? What do they want to hear that will make this loss, this bereavement, the loss of a loved one who you hoped you'd have the company of and the influence of and the feeling of being near them for many years to come, and you haven't. What is the point of sitting in there? Why would you have wanted to be in there today?
Do you know, I think there are so many questions that people have. Why didn't we lock down earlier when we knew this was coming? Why did we delay and have things that contributed to a second wave? And I think a lot of trust has been broken, and a lot of people, the care home situation. I mean, we heard last week Jenny Harris saying that it was okay to send positive patients back into care homes. There are a number of the bereaved are people who've lost people in care homes. There are a lot of answers being sought right now, and trust has been totally broken, and people want accountability, and this is a step towards that.
And Peter, how surprising or unsurprising was Boris's very emotional response? He really did seem to be fighting off tears, not necessarily with great success.
I think it's fairly straightforward and predictable that he gave an apology. That was probably always going to happen. A number of people have done that at the start of their evidence, particularly political figures. Matt Hancock did the same thing in his first tranche of evidence. With Boris Johnson, we saw a slightly different character here today. He wasn't the blustering, confident. He was answering the questions as, I think, probably about as well as he could have. You can't remember everything that happened last week, never mind a few years ago. There are questions, of course, about the WhatsApps and 5,000 missing WhatsApps that seemed to be a technical error on his phone. There was one point where he sort of slightly comedically tried to explain what was going on technologically. That wasn't ever going to be a satisfactory answer. But certainly when we got to the point where the strain was clear, we've got to remember he is a human being. I'm not excusing his actions at all. I'm sure there are many people who are very, very upset about many things he did, but certainly his emotion was on display in a way we haven't seen before. So we did see a slightly different Boris Johnson today.
Yes, I've already said on the programme that I used to have him as a guest in my studio live about every 4 weeks for years and years in the 2 mayoralties, and he certainly isn't the kind of human being who trades on crocodile tears or indeed tears at all. That's not his thing. He's much more like to bluster on through and not cry than behave the way he has today. I don't think any of us have ever seen him in publicly behaving like that. So let's talk about lockdown, partly because, Dr. Ahsan, when you joined me earlier in the programme this afternoon, you did lock horns with Isabel Oakeshott, our international editor, about lockdowns at all. And she said to me, I think quite accusingly to me, Vanessa, you could have got another doctor who would have said something very different about lockdowns. And then she cited a particular declaration. And I know that you very much wanted to clear that up in your own way.
That is you could have, but you would have been going for a minority view if you'd gone for another doctor. The majority of doctors, including the WHO, thought the Barrington Declaration. Look, the concept behind it...
What is the Barrington Declaration?
So basically, there are 3 authors. not one of them was an infectious diseases doctor. No one was actually a clinical doctor as such. I believe one of them is, I believe, but an epidemiologist, someone else who deals with the public economy of health. They argued that we should not all lock down, only the vulnerable and those who need to shield should lock down and let the virus rip through and opt for herd immunity. Now, there were, in principle, you know, it sounds logical, but in practice, no one really knew who was going to suffer from COVID worse than anyone else. It was a lottery whether you were going to become seriously unwell with COVID. We don't tend to do herd immunity with an infection. We do it with a vaccine. This was the first time an infection that many people had seen was being used to generate the argument of herd immunity. Everything was a bit upside down. And, you know, at the end of the day, it was a declaration that was funded by a libertarian free market think tank. It's not a widely accepted
Why do you think
theory.
they're wrong, if you don't mind me asking?
Because in terms of just having people shield and everyone else.
Yeah, I mean, they said obviously that the vulnerable should shield and be locked down.
Yeah.
But for most people, I just wonder, I would question certainly the wisdom of locking down for such a long time and all the effects that have happened.
Oh,
But why do you think they're wrong?
Yeah, 100%. Number one, as I said, it's a lottery. I had patients in ITU who were young fathers in their 30s.
Well, that's the thing.
Exactly. You just never knew who it was going to
I'd really like to echo this. I'm not a doctor, but I was broadcasting every day, and obviously people were busily ringing the radio station, the BBC at that time, because they didn't have anything else to do because they were stuck inside. So the calls were coming in thick and fast. And very, very early on, it was absolutely clear that no individual would know how ill they were going to be. And you know, that it was being stated absolutely categorically, you'd have to be very, very old or very, very vulnerable or have some underlying health condition. And if you hadn't, you'd be fine. And that was not the case. It was just not the case. I remember speaking to somebody who said, he'd almost died. He'd been on a ventilator. He'd been had the most terrible, terrible experience. He was barely able to walk for weeks afterwards. And it was absolute touch and go. And he was a young tree surgeon with no underlying health condition. That was happening, in my opinion, all over the country and the world all the time. So it wasn't a straight up, if you're old, you might die. If you're very young and vulnerable, you might die. Otherwise, you won't die. It wasn't at all, was it?
No, it wasn't like that. And as you're saying that, I'm recalling a young father of 3 in his early 40s crying before he was intubated and sedated, begging the consultant, please let me wake up for my kids. He didn't. So he had things like that happening a lot. And I suppose it might be easy to have opinions like that when you're not in that space and seeing it happen in front of you, forming opinions based on healthcare workers. These 2 of the 3 authors are doctors, and they just come from an alternative perspective. Their paper wasn't peer-reviewed. It wasn't really scientifically robust. But a lot of that was getting into the spaces, the vacuums that had been created, I think, by some of the confusion from leadership. At the beginning, Boris Johnson was going around shaking people's hands.
Yes.
He's
and making a virtue of it and saying, I'm shaking hands, didn't he?
So he created a vacuum.
But it was an airborne virus. I mean, shaking someone's hand wasn't going to give them the virus, was it?
That's true. But at that point, we didn't, still it was a bit unknown, and I still wouldn't shake hands with someone who's infected,
And also, unless they just sneezed over their own hand and then shook your hand.
Exactly.
Or they've been eating an apple and licking it and all their saliva was on their hand.
You wouldn't want me as a doctor coming to look after a patient with COVID, have my hand and then
I suppose the point,
I
suppose the point, Isabel's not here, but I suppose the point she might make is that, without those confusing messages that you rightly say were coming from the leadership, a lot of people just didn't know what to do or what to believe along those lines. And you actually had the medical profession, as we've seen from this inquiry, that people kept saying follow the science. Often the science was confusing and developing, and the kind of projections that were there, for example, 800,000 we were told were going to die. Thankfully, that wasn't realised, that there were confusing messages. And then, of course, you have a political class that's not following the lockdowns either.
And those figures were coming from modelling. I remember very, very early on, I was making films right from the early stages of COVID, And I was interviewing modelers as opposed to public health experts or infectious diseases experts.
Just explain what modelers do very, very briefly.
So they look at the landscape and then they predict data and numbers. So a lot of these numbers were coming from non-medical people, modelers. There was a lot of reliance, I recall, on modelers. I'd never really heard of them.
But
being
there
so
were,
involved
I
in
mean,
that
the
point.
chief, you're absolutely right, and sorry,
Yeah.
but we also saw the chief medical officer, chief scientific officer, of this country and the government of this country relying on a lot of those models and saying this will happen.
Yeah.
And that added to the confusion of the messages. I think.
As we've been seeing unfold from the inquiry, and Patrick Vallance and Chris Whitty were talking, and I know Chris Whitty at that point was also trying to balance public health impacts with lockdown. I mean, some of them in hindsight have also suggested that more robust action needed to happen sooner. But this was impacted further by having a government and leadership who were, I think, leaning towards the opposite side, and so
They still did it though. They did.
When there was really no other option.
actually, I mean-
And can I just ask, because frequently, especially at TalkTV, there are people who are very adamant that lockdown was a terrible mistake and maybe the first one was acceptable, all of the rest were a dreadful legacy. Nobody still can measure the abominable harm done in so many different ways to so many different people.
Yeah.
And it's become a view, I think, that some people parrot without even thinking it. Now, having heard it so many times, they simply think it's fact. It's just, yes, it's true. The first lockdown was inevitable. The rest were a terrible mistake. The legacy is shocking for everyone and they never should have happened. But if we had adopted the Swedish model or if we hadn't locked down, what do you think would have happened, first of all, to the NHS and secondly, to the figures of death?
Oh, I think the numbers of deaths would have been higher. Definitely, because you just have to look at what happened to the numbers after the lockdown. The charts are all there. The R numbers would be going up, the deaths and mortality going up, and then you'd unfortunately have to lock down for a period of time, and then the numbers would drop down again. It didn't mean that everyone would be immune from catching COVID, but by that time it allowed us to get to a point of a vaccine. Mm-hmm. And that's what we were, it was trying to save lives and buy time to find a way to get a weapon against this virus. We didn't have anything. As Boris Johnson said, the only tool he had in his box at that point was a lockdown. If you lock down early, and this again, it just speaks for itself. If you locked down early, if you prevented this airborne virus spreading and people catching it either symptomatically or asymptomatically, you would then reduce the R number. That one person would spread it to less other people.
There is a big point to make, though, and I think the COVID inquiry needs to look at this in terms of the operating theatres that were lying empty, the people who thought, protect the NHS, therefore I'm not going to go to my doctor with an illness I think I have, or get checked out, the mammograms, the cervical smear tests, all those kind of checks that weren't done because people thought they had to protect the NHS. I think that
they weren't only trying to protect the NHS, and I'll say this.
That's what they were told to do.
No, I will say this from personal experience. I did have people who were delaying coming in, but they were terrified of coming in.
They didn't want to catch it.
They didn't want to catch it. That's why I didn't come in. I had a poor woman who had broken her hip. She didn't come in for a good few weeks. I'd never seen that. If someone breaks a hip or fallen and
the messaging was wrong in terms of protecting the NHS. People should have gone to their doctors or sought medical help.
If people had, a life-threatening or
but they didn't, and they were told not to by your profession and by the government.
They were told no. The message that we were giving, if you need to come in, because we tried to create safe spaces. However, having said that, when you're walking into a hospital, the viral load is huge. It's everywhere. I talked before. If you could colour code it, you would have seen it everywhere. But it was a risk and people were having to make that decision. It was a really scary decision to make. And that's what we were trying to avoid by catching it early, learning from the lessons of China and Italy. Give us a chance so that we don't have to come to
There
this
are so
awful
many. There
position.
are so many societies. There are so many, and we're seeing it now. We're seeing the excess deaths. We're seeing people who didn't go to get things checked out when they probably should have. We're seeing the mental health effect of lockdown. I think there is a debate to be had about lockdown. I hope it's had at the inquiry.
Yes.
You know, you're a doctor. You were there. I'm not taking anything away from that, but I think there is more of a debate to be had. I hope the inquiry looks into
I'm
this
going to
properly.
thank you both very much indeed.